We're now moving more into the enabling technologies area in terms of technologies that we're looking at to advance health extension. And we are moving more into machine learning, and we're more moving into aging clock areas. And we're super happy that we have Alex here, who is actually working on both of them and connecting the two dots. And he's not only from Insilico, but also now from Deep Longevity, and is trying to do longevity as a service. We will hear all about it from him, and he can do that much better than I can, but I'll share your bio in the chat. Super excited to have you here. Thank you very, very much for taking time. And yeah, the stage is yours before we move on to a discussion, and I'll be in the chat in case anyone has any questions. All right, welcome, Alex.
Well, thank you, Alison, for such a generous introduction, and very happy to see everybody. Lots of familiar faces, some very good friends, and very happy to be part of your series. I've attended a couple of those, and actually, I must say, I must compliment you on the effort. It's very useful, and you're bringing a community together. So. The community that I hopefully will be talking about now as well. And I'll share my screen because I am more of a visual person, and I hope you are too. And especially considering, it's 2 a.m. in Beijing right now. That's where I'm dialing in from. It's probably easier to have a visual aid. Here you can see my WeChat. I use WeChat most of the time since I am very focused on Asia. If you see any Chinese characters in the slides, sorry, we are in this region, and I'm very focused on China. Today, I'm going to be talking with you about longevity as a service, or LAS. I think I coined the term. I'm going to speak from the position of Deep Longevity Officer of Deep Longevity. Deep Longevity is a spin-off out of Insilico Medicine. We spun it off in 2019, even though we've been doing work on aging clocks since our very inception. And we sold it to a company called Regent Pacific. It's publicly traded on the Hong Kong Stock Exchange 0575, and hence the disclaimer. So not an investment advice, never buy the stock based kind of presentations, especially if it's by me. A few words about Regent Pacific, the mothership of this of Deep Longevity. So the chairman of that company and the founder is actually Jim Mellon as well. So a very famous person in our field. So if you look at his bio, he actually kind of originated. He started his career in Hong Kong, and he has deep affinity with the region. So it's not a paper company. It's the entire floor in the Hanley building right next to HSBC. And it's a holding company. They returned quite a bit of money to the shareholders over the years. And now they're also focusing on longevity and also male health. So they have some other products in the pipeline focusing on male health, primarily in China. So before I start, shameless promotion of our annual meeting. It's currently, I think, the largest in the world in drug discovery in aging research. Last year, it was 2.6 thousand people. You can see that it's supported by all the major journals, Lancet, Nature, Frontiers, eLife is sponsoring it, and Frontiers is sponsoring it, and also Aging. Usually we publish the proceeds. This year, it's going to be our 8th annual. And for the first time, we'll have the longevity medicine workshop to specifically focus on not only the science of aging, but also on clinical applications, because you cannot do longevity as a service without the physician's buy-in. And we are doing a lot of work right now to actually steer the physicians into the field of longevity, give them the ability to speak the same language, at least introduce the very basic concepts, and provide them with a toolkit that they can use in order to also engage in N-of-1 studies and experimental medicine. So one interesting kind of factoid is that in December last year, myself, Morten Schreiber-Knudsen, Alexei Moskalyov, and Eva Biskov, half MDs, half PhDs. We developed a course called the Introduction to Longevity Medicine for Physicians, and put it on Udemy. And you can see that 2.6 thousand MDs took it, and it's a pretty popular course now. And we decided to also make it free because Udemy does not allow you to put just free course that is more than an hour, I think, online. So we moved to Teachable, and you can actually find this course on longevity.degree. We're making a portal now for longevity education because I think that the bottleneck and also the central driving force are the physician. I think that physicians are the core kind of bottleneck and the central driving force. That's why we cannot really ignore them, and we need to ensure that we engage them. And I think that I might not be the first person to say that, but our industry will move at the same speed as the physicians do. So we cannot move faster than the physicians if you are to provide longevity as a service. So you need to engage physicians, and that's what we're trying to do as much as possible. As you can see, it's actually gaining tractions. There are not that many longevity physicians in the world, and many of them took this course. So now that we've moved to longevity.degree, you can actually take a 2.5-hour course. All of them are likely to be free. This one is definitely free. We also moved it into Chinese. So I think that China is going to be a major driver for anything, including longevity. So actually, if you haven't been to China, I highly encourage you to come here because it's just marvelous. So everything is high tech, and it's outpacing Japan in terms of technological innovations, high-speed trains, everything. So in longevity, there are also multiple efforts for people who really want to get more out of their life, and they understand that money is not just where it ends. So they're spending money on this, and there are multiple pretty substantial initiatives in longevity medicine as well. By the way, we also got CME accreditation for this course. So if you are a medical doctor and if you take this course, you get 2.75 AMA credits, and you get a proper certificate. So I think that's probably the first longevity medicine for physicians course that is CME accredited. Took us about half a year to do, but now you actually can get a medical certification when you do that. So now I'll just switch gears and talk a bit about, I think that you are convinced that aging is bad. Humans, I think, are the only species that also understand consciously that they are aging and dying, and that the future is bleaker than today after, 25 for women and 30 for males. So everything in the future is downhill. And nature even evolved us to ignore this problem consciously and focus on more current events, right? That's why FFF takes precedence over anything, and it becomes addictive. So we try to avoid thinking about aging, and we are now starting to think about prevention. And prevention is possible. You can move this curve to the right slightly, but at the end of the day, if it's diet, exercise, sleep, you pretty much get to the same end. Maybe a little bit healthier and a little bit longer, but still you are losing. Actually, in Chinese, aging is very often associated with losing. So that's why people don't like to talk about it. But we want to talk about it, and we can think about possible ways to track, repair, and improve. Great to see Aubrey here. He was the first one to come out and turn it into a movement. So I think that we should not be shy. Very many people think about this as not a credible goal, and also if you are in a pharmaceutical company, you would not show this slide. And I think that now this movement is becoming more credible, but people are still too afraid of giving themselves false hopes, and they're still trying to plan their lives and their reproductive cycles and their entertainment, their outlook on life is very similar to what it was, centuries ago.
Alex, I'm still
but
on
now we are.
Alex, I'm still on the certificate slide. I don't know if everyone else is too, or
Really?
are you trying to show a different one?
Yeah, I'm showing a very different one, and
okay,
that means that
now I got the one with the mountain. Is that the one?
Yeah, so that we have a great firewall here. Yes. So, and I hope that you can see already track, repair, and prove, right?
No, I'm still on the mountain. Maybe I'm the only one, but
yeah, no, I see track, repair, improve.
Okay, good.
Okay, so that's not me. So thank you, Aubrey. Great help. So telling Aubrey's story in a different words. Basically, next slide is that how can we provide longevity as a service today, right? Because there is actually, the toolkit is very limited. And from my perspective, if we are moving at the same speed as the physicians do, it's going to take us a very long time to be able to, save the baby boomers, for example, because chances are that by the time we get rejuvenative technologies in the hands of medical doctors, it's going to be a little bit too late for the baby boomers. And that's why we are trying to define the field of longevity medicine. Longevity medicine is cutting edge research, science, therapy, and diagnostics. Currently, it is primarily focused on participatory medicine and personalized science. I hope that you can see the slide, longevity medicine. And it's powered by biomarkers of aging and longevity, predictive and prognostic. It's data-driven, individualized, and preventative. And now we have artificial intelligence to help us move in this field. And traditional preventative medicine looks at you in the context of, looks at the patient in the context of their age range and in the context of their well-being for that age range. So if you don't have, too many comorbidities when you are 60, the doctor would still diagnose you as healthy. However, if you compare yourself in the context of your entire lifespan, of course, you are much worse off than when you compare yourself to when you're 30. So,
Alex, I think we may need to hop onto the next slide once more. It may be the firewall. I think I'm not the only one starting to see the slides. I'm still on, can we provide longevity as a service?
Okay, you know what? Let me pause for a second. There are not that many people.
Now we have traditional preventative medicine.
Yeah, so it's freezing. So let me just kill my other screen. And if the worst comes to worst, I'll need to go to my 5G right now. So let me know if it happens again. And I'll have to go into my 5G. I apologize.
No, totally fine. You're also welcome to send me the slides via email and tell me when to advance.
Yeah, so let me try to, I hope I'm sharing the screen right now. Can you see it?
Not yet, but I'm looking, I'm monitoring the chat. Yep, now I see the screen.
Now so you see this traditional preventive medicine slide, correct?
Yep.
Great. So that's what I was talking about. So in the context of traditional preventive medicine, the doctor looks at you currently, right, at this time, and looks at the age range, maybe 60 to 70, and looks at how do you do in terms of performance for that age range. Ideally, we want to look at the person in the context of the entire lifespan and figure out how to bring the patient back to the ultimate healthy state, which would be 20 to 35 or 20 to 40 at least. So how do we track, repair, and rejuvenate? So basically, it's sense in action. How do we turn sense into clinical practice, for those of you who are familiar with Aubrey's work? And AI can help with that. So now how do we do this in the context of longevity as a service? Well, that would require as I define kind of 7 pillars of clinical engagement. So first, you need to educate and involve. So for that, we've got this longevity medicine course for both physicians and actually consumers can take it as well. It's just 2.5 hours. The reason why we made it so is that physicians are very busy, and in 2.5 hours, you can just get all the content you need to be able to navigate in this space. Then you need to do really advanced anamnesis data analysis. So basically questions and answers with the patient. Now AI can help with that as well. Comprehensive longitudinal diagnostics. So we need to collect data over time, and all of you who are not collecting the data are losing already, because it's extremely important to have this benchmark ideal you to be able to bring your future self back to as close as to this ideal version of yourself as possible. We need to identify what I call longevity bottlenecks. So the aging clocks that are ticking faster, and the aging clocks that are and the areas that are likely to age faster in the context of individual patient, and drive the rest of the organism with them. So I see, for example, on the general population front, when you are doing aging clock analysis on different tissue, we see that lung, liver, kidneys, bladder, they tick faster than many other tissue types, like for example muscle. However, in the context of an individual, they might have different individual longevity bottlenecks. Then personalized risk and benefit analysis of interventions. So some people are more risk averse, some people are less risk averse. So we need to look at longevity products as financial products, because look at longevity interventions as a venture business. So you need to understand that many of those unproven and maybe less proven interventions, they bear a certain risk, but they can also give you a certain return. So the individual and their advisor or financial advisor, longevity advisor, may provide additional guidelines and guidance on how to plan their longevity interventions based on risk-benefit analysis. So now actually we're coming up with what we call know your patient strategy and questionnaire to understand that risk profile and educational profile. And then, of course, we can slow down and reverse aging with different interventions. And that needs to be driven by aging clocks that measure every level of human organization. So who are the stakeholders in the longevity economy? So what do we need to do to get to the point where we can provide longevity as a service and we can get the doctors engaged? Doctors won't just engage without the clinical protocols, without the proper training. They all gave Hippocrates oath, and they all follow the rules. They're all certified. So a lot of stakeholders need to engage in order for the doctors to be able to follow. And those are, well, first of all, academics. So what should we expect from academia today and also in the near future? Of course, we see major advances pretty much everywhere. The worms live 10 times longer. We see major advances in mice. We see new geroprotectors. New companies are entering the field. However, new academics are entering the field. And in China, for example, the Chinese government also wisely prioritized aging for the next 5-year plan. More action is expected to come from those efforts. However, the academic efforts, I operate in the pharmaceutical industry at Insilico. So for the academic breakthrough to come into the pharmaceutical clinical trials, it's usually 5 to 10 years. And then clinical trials take another 5 to 10. So if you look at the field of immuno-oncology, the academic, which is pretty rapidly progressed, we see that it progressed over the course of 15 years from academic breakthroughs, those early PD-1s, PD-L1s, and started picking up, right? If you look at the history of those checkpoint inhibitors that are now, driving progress in oncology, this is 20 years ago, 2002, 2003, and then they started to be commercialized around 2010, 2008, 2010, and only now you've got an avalanche of those products on the market that are now saving lives. But for longevity interventions, it's probably even longer because you still need to go through this. So a lot of academic efforts should be encouraged, and we should understand the basic science currently, but we also need to look at what we can do today. And if we look at what is available in the pharmaceutical industry today, and I think that it would be probably not even too ostentatious to say that I probably am one of the most informed people in terms of the pharmaceutical industry's efforts in aging research. I work with top 25 pharma companies at Insilico, and out of the top 20, at least 6 prioritized analytics, for example, in their early stage R&D. However, if you look at those efforts and how they come and go in pharma at GSK, for example, or Novartis, they're not really prioritizing this R&D for the clinical use, right? It's just they need to spend a certain amount of money on R&D. They do it. They try to be prepared for what's in the biotech sector, so to be able to acquire. So we shouldn't really expect huge progress from the pharmaceutical industry over the next 10 years. And currently, of course, there are very promising companies like, for example, BioAge. So Christian Fortney just in-licensed some assets from Taisho and other companies. The HIF inhibitors that might be repurposed and purposed for aging. It's a very similar story to Restore Bio. We understand that the practical utility of those interventions in the context of possible longevity gains is marginal. So we're not looking at 50 years plus. So we really need to, of course, engage pharmaceutical industry and look at them seriously, but at the same time, we shouldn't expect too much, right? Because they are driven by the market, and currently nobody has put aging and longevity on the flag and decided to go on phase 3 clinical trials for that. So from the clinics, we also should not expect significant progress, because the clinics are driven by the medical doctors, by the medical community, and also by scale. So in order for you to institutionalize a longevity intervention and make it big, you really need to have scale. So you need to have something like McDonald's or something like retail clinics. And there are some clinics like that in the States now, pretty broadly, with many digital tools for diagnostics. But for treatment, you still need to go through the classical physician and in the hospital. So clinics will follow the clinical protocols, unless you're talking about some illegal clinics in Mexico and some exploratory N-of-1 studies within some small practices. Currently, they lack scale. And insurance companies, of course, I think that, so my big bet is on the insurance companies, because currently they need to compete and become more innovative, and many of them do. So they are trying to look for additional interesting products for both customer acquisition and also for underwriting. And some of them are even combining the two and allowing for some additional health procedures to be performed on really, let's say, high net worth life insurance customers. However, again, there is no major central effort. So what where I'm leading to is that you need to figure out how to turn this into a longevity ecosystem faster and accelerate. And the way to do this, as again, in my mind, you have to work with the physicians, and the physicians need to be the driving force. They need to demand those interventions. They need to start experimenting. And in terms of what we can do today and tomorrow, again, there is not that much. So we are still dancing around diet, exercise, sleep, and some very basic geroprotectors, and basically do what your mother told you and get more frequent diagnosis. So currently, the outlook on the near term is actually quite bleak. But what we can do tomorrow, and this is a slide from the longevity medicine course. So you can see that there are drugs out there. Some of them have been in clinical trials. Some of them are in clinical trials. So we should expect some of them to come to the market. Some are actually already on the market, like an AD boosters that are likely to give you maybe a small edge, but also increase the risk of cancer. Now we see that there are some other effects on blood biochemistry because we have a large cohort of people who are taking NMN and NR in high doses, and we have their blood. So not all the effects are positive. There is glucosamine that you can take right now. I think that's probably one of the safer geroprotectors. And this is the toolkit that a longevity physician can use today. Some of those treatments will be highly quote unquote experimental, like rapamycin. I cannot confirm or deny that I take it, but I do have some with me just for as a kind of lucky charm. This is what we can play with. What's coming up is some promising targets, some promising interventions. I'll actually just skip through a few slides because many of you got lectures specifically on those subjects. Now there are multiple interventions. You can now combine them. The first step that we can do currently, and that's available, that is tangibly proven to bring value, are the different measurements tools for aging. And the biomarkers of aging are now becoming available and are more popular. But, and we are one of the kind of thought leaders in the field, published multiple papers in this area. And I must tell you that we're still scratching the surface. We do not really understand what do these markers tell you. We do not really understand how to properly combine them and how to improve them so they give you a really good picture of aging, something that we can turn into a digital twin. So of course, we're trying to get there, but I think that we are very, very far from this. And actually, that's why I deeply respect the work of, for example, Vadim Gladyshev and scientists in the same league who are really trying to dig down and dig deep into the very basic biology of aging, and even going back into, in utero and looking at how we age, because currently we don't understand what those biomarkers are telling us, but we can now predict your age. So we can predict your age with a good mean absolute error, and we can now interpret those aging clocks into specific individual features that now we can even tweak. Whether it's going to benefit you or not, most of the time we do not know. But some of those biomarkers are modifiable. And I think this is the first frontier to a longevity ecosystem. And of course, you've got lectures on every one of those clocks already. The first one was Horvath and Hannum, published approximately at the same time. Epigenetic aging clocks. Epigenetic aging clocks are the most accurate, but the most difficult to interpret or turn into therapeutic intervention at this point in time, unless you're doing reprogramming, demethylation, or remethylation. And AI can help with the methylation clocks as well. It can help in many ways. So what I specialize in is deep generative reinforcement learning. So generative adversarial networks allow you to create synthetic data, synthetic profiles of people. Here, those images are computer generated in 2017. So those are early days of GANs. Nowadays, those people are completely indistinguishable from reality. You can basically describe what you want to see. You can say, I want to see a white male with blue eyes and with sunglasses and bald. And you'll get a distribution of those. Or you can give a network a template. Let's say you give it Brad Pitt and say, okay, well, show me Brad Pitt who is 80, Asian, and female. And the many features of Brad Pitt will be retained, and you'll get a distribution of those images where the generation conditions are confirmed. We use that technique a lot to synthesize biological data, and we also use it for biomarker discovery, target ID. So you can tweak some features in gene expression data, for example, when you're giving a network a template, and then you ask this network to generate a distribution of people from the current age all the way to, let's say, 120, or you can play around with it and try to go 150 and see how those features change in time. So pretty much like aging a picture, but instead of a picture, you're aging another biological data type. So that's how you can also identify targets and promising interventions. The same technique can be used in many other areas of human biology research and chemistry research. So we use it a lot for molecular generation. That's what Insilico Medicine's primary expertise is, and that's where we managed to establish collaborations with pretty much every big pharma, which is innovative. So many of them are deploying our software or deployed our software. We can also now use it for mental health, depression, motivation, behavioral modification research, and of course for aging biomarker discovery. So deep longevity is now in all of those areas. You can see that even from synthetic data, you can now derive the most valuable biological data, which is age. And the way we do it, we use feed-forward deep neural networks, convolutional deep neural networks, and other machine learning techniques, where we feed a specific data type into a model annotated by age with as many features as you want to predict just one feature, age. And with the increasing level of sophistication of those models, and also with the increasing granularity of data, you can now try to go and understand basic biology or even basic psychology through those networks. So we're experimenting with that a lot. Also with some non-traditional data types like psychological survey data. And you can try to go and understand the causality of the different biological processes by predicting age in different age groups and looking at how important the features are for predicting age, for example, within a specific age group and deriving the possible drivers. So trying to establish the cause and effect diagrams. But again, synthetic data generation currently is one of the most valuable achievements of deep generative AI. Now you can also train on age, and then you can add additional neuron for health status, for example, for a disease. And we've done that recently at Insilico. So about a couple of years ago, we identified a novel antifibrotic set of antifibrotic targets and discovered molecules for those targets. But the main idea for those target discovery efforts came from this diagram. So we basically trained on age and then retrained on different types of fibrosis, identified valuable targets by looking at the different features that might be causal, might be driving the fibrotic process, and then we put them into pathways and established biological relevance, the disease hypothesis, and identified targets. So you can do this for many other processes. And also it provides you with a pretty good business model, because if you are targeting an age-related disease and at the same time aging itself, that provides you with a clinical pathway where you can do a net present value on the asset and get a pretty substantial valuation for your company and fundraise for additional research. And possibly that drug might work in aging as well. And there are multiple biomarkers of aging that are using deep learning. So I think that the first one that was published in a peer-reviewed journal was published by my group, by a brilliant young scientist, Evgeny Putin, no relationship to the other Putin. And we got the first blood-based aging clock with mean absolute error 5 to 6 years. with reasonable R square. And now it's a workhorse clock for us since 2016. So a lot of people are using it, and now a lot of people are replicating the work and turning it in commercial practice. We also published a transcriptomic aging clock. We published it as a patent. It's a patented clock, actually granted. And microbiomic aging clocks, different imaging clocks, facial imaging clocks, physical activity clocks, psychological aging clocks. And here is just our kind of efforts in publishing in this area. We collaborate with some of the giants in the field, including Vadim Gladyshev and including Eric Verdon and others. And so far, we've developed a variety of aging clocks that can cater to this longevity as a service community from different angles to different stakeholders. So the real workhorse clock is the deep hematological aging clock. So this is basic blood tests. And now we also, through generative approach, we can take very small number of markers, let's say 20, 25, and then reconstruct the rest using GANs if we're lacking. But of course, if we get up to 70 parameters where we do have abundant training sets, the prediction is becoming more valuable, and we can interpret it with more utility, because now we can also look at specific features that we can change in order for you to look younger to the deep neural network, even on this data type. So most of our experiments and also most of the published work is on deep hematological aging clock. We call them blood age. We also, of course, the most valuable clock that I know of is the deep transcriptomic and deep proteomic aging clock. So we've built a bunch and patented. There you can derive valuable targets from the clocks, and also they are much more interpretable than any other data type, but they're also much more variable. Microbiomic aging clocks and psychological aging clocks are also currently being deployed by our company. The very simple idea and the concept of a deep aging clock is, I already kind of depicted it before. You take a very large number of features, let's say 50 markers, 40 markers, very large number of profiles annotated with age, and you train deep neural networks with the features, for example, blood markers on the input layer. So it could be your albumin, glucose, alkaline phosphatase, urea, BON, going on the input layer. Then you have many interconnected layers of neurons and one neuron on the output, predicting your age. You can either use one deep neural network, or you can stack them into an ensemble. And now, of course, this was 2015 when we did this work, and 2016 when we published. Now, of course, those are much more advanced, but the basic concept is preserved. So you've got different features on the input and just one feature on the output. And you get pretty reasonable prediction accuracy. So in our first clock, we've got 5.5 mean absolute error. And at that time, we started noticing that people who are predicted to be older, they also have all kinds of comorbidities and they are less healthy. And people who are predicted to be younger than their chronological age, they are usually healthier and they have less comorbidities. And we've demonstrated another paper where we compared different populations, Canadians, Koreans, Eastern Europeans. We showed that in every population, if you are predicted to be 5 years or older than your chronological age, and by the way, we tested on an independent data set that was not used in training, annotated also with mortality data. So if you're predicted to be 5 years or older than your chronological age, your hazard ratio increases substantially. If you are predicted to be younger than your chronological age, 5 years or younger, your hazard ratio decreases substantially. So this is extremely important for underwriting, for insurance companies, and also important for the longevity clinics when they explain to customers why they need those clocks. So once you can tell a story that those clocks are valuable because you can decrease the risk of dying of any cause, people have become more engaged, actually, in both communities. And this is the kind of central basis for connecting the clinics and insurance companies together with the clients, because in this case, the interests of all parties are aligned. And this is how you can really provide the longevity as a service in the future. So that's what we are trying to build, this interlink between the insurance company, the clinic, and the customer. I'll skip a few slides. We have published multiple aging clocks using different data types, but the philosophy is the same. You take a bunch of data, train deep neural network to predict chronological age in a reasonably healthy state, and then try to deconvolute those networks into most important features and try to interpret. So currently, we developed two tools at Deep Longevity that kind of are trying to bring the ecosystem together. So one is a young AI app, which implements multiple aging clocks, and you can access it for free right now at young.ai. You can upload your blood tests, you can upload the PDF, you can take a picture of the PDF, and it will take your blood biomarkers and predict your biological age. And then tell you what features are driving the prediction, and then you can work with a physician to modulate those features in order for you to become younger. And we also work with the clinics. Currently, 18 clinics have deployed those aging clocks, including some of the really elite clinics like Human Longevity in San Diego and several others, like Hooke, for example, Hook in London, and Life Hub in Hong Kong, and many others, Boulder Longevity. So many of those clinics are experimenting with those clocks in one way or another, but now we're getting quite a bit of data before and after intervention. So for the clinics, we provide those kind of reports, we call Agemetric reports, where the different data types are being sent to the network. We do not know who is the patient. We are only using anonymized data, so we do not keep the personal data in any way. The data hits the network, and the network just provides the automated report, the predicted age, and then provides you with the different recommendations. Usually we work with kind of the workhorse algorithm is optimized for 39 markers. That's blood age optimum. It has a slightly higher price tag. Those are very cheap tests because we're already using somebody's data that was collected elsewhere. And blood age minimum, 31 markers. As you can see, no rocket science, all the very standard markers like potassium, chloride, sodium, white blood counts, red blood counts, glucose, bilirubin, BUN, ferritin, creatinine. So very, very simple markers, but they are actually telling a really interesting story. And you can narrow them down back to the individual organs. And how it works in this part of the longevity service, you can take a simple blood test, request a report. As a physician, you can review the report, help make some changes, and then follow up again and do this again. And currently, we're doing it with several clinics. We hope to be able to publish soon because now we have quite a bit of evidence that some interventions might be moving the needle in one way or another. And those age-metric reports are also quite interpretable. So some are less interpretable, some are more interpretable. For example, psychological aging clocks are very interpretable. Hematological aging clocks are also very interpretable by the physician, and transcriptomic aging clocks you can interpret using an algorithm, but also already using the experience you got by interpreting the aging clocks where the features are very well known and understood, and people are trained to tell the story based on those features. So this is how those features look like. So for example, we tell you, okay, your white blood count is here, total cholesterol is here, maybe it's within range, but if you want to be 5 years younger, you need to, let's say, reduce the cholesterol to this level. And recommended value is, let's say, 174, and then you will shave a few years from your predicted age and get to, let's say, 36. And currently you are older. So currently, this is the structure of the report. Human Longevity is also one of the very active users. So I actually highly recommend going to HLI and getting their comprehensive test. So you will know that you're cancer-free, but at the same time, they will give you the aging clocks. And I'll skip a few slides. That's the just reporting structure, how it looks like. So you can also see how much does individual feature like albumin, glucose, triglycerides, cholesterol contribute to you looking younger or older. And what happens if we modify that feature to a specific value in the reference range. So you can see that albumin provides in this case is making you younger, and glucose here making you older, so 3.9 years than your chronological age. So if you were to modify those features, you can come closer to your chronological age. Or if you want to become younger, the system will tell you how to modify those features to get younger. And again, I'll skip a few slides. Yes, and you also can use all kinds of techniques like self-organizing maps to show where you need to be to get to your optimal healthy state, and also to your 20 to 40. So what do you need to modify over time? Currently, we're doing a lot of research in this area, and we will be trying to deploy some of those tools, also visual tools, for people to try. And one other important aspect that we are trying to get into right now, trying to understand, is the psychological age. So currently, if you think about all the features, anything you can do in the context of aging, the effects will be very marginal, and there is actually not that much you can do. So you can modify sleep, you can modify diet, you can modify your exercise routine, but that is what your mother told you, right? But can we, people are still trying to dig in, what is the optimal diet, what is the optimal exercise routine? In my mind, of course, it's important research, but not as important as fundamental research in biology of aging. So we thought about, can we get into psychology using AI? So can we try to predict your psychological age? That's the chronological age in the absence of mental health challenges. And can we predict your subjective age? That is, how old do you feel physically and how old do you feel psychologically? To try to maybe play around with the deep neural networks in a way so that we can, as humans, interpret those features and see if they make sense. So we came up with a hypothesis that biological age and psychological age, such subjective age, are connected. We looked for the multiple databases that are available with longitudinal data, with surveys, also that links the surveys to some biological data, and started working with MIDAS. That's the midlife study in the US data, connecting it to all kinds of other data sets like Enhance and UK Biobank. And again, came up with two features that I consider to be very important. One is psychological age, which is chronological age in a healthy state, and subjective age. It's basically how old do individuals feel. And now we're even exploring ways to create feedback loops from to basically explain to people how they feel, so they can record that feeling, and at the same time correlate it with different digital biomarker data and measurements, so they can actually train to feel themselves better, because we are actually the ultimate sensor. So how old do you feel is a very important question. So we are asking this question, and at the same time looking for a very large number of features from survey data and behavioral data that are modifiable. So we are excluding non-modifiable features, like, for example, parental age, kids' age, as age of death of family members. That you cannot change that. So let's not include it in the predictor. And we're looking for modifiable factors that are, health status, education, physical activity, longevity expectations. That's my favorite. Work, biomedical knowledge, another favorite. Social relationship, psychological support, personal beliefs, another favorite. And then we're predicting age, psychological subjective age using neural networks, and trying to see how those predictions are correlated with different factors of well-being, such as mental health, physical health, resilience to stress, productivity, happiness, longevity, etc. And in our first experiment, what we did, we took MIDAS data set, It's anonymized data. So big thanks to the U.S. government for doing that, because it really advances not only their social and behavioral research to understand, the consumer behavior, but also gives us the opportunity to do this kind of experiments. What we did, we took originally about 1,000 features that were modifiable, narrowed it down to 50 features, and looked at the most important features, adjusted the feature list so that those are interpretable, modifiable, and at the same time not directly correlated with the chronological age. And trained the predictors for psycho age with about 6.7 years mean absolute error. Now we can go down to about 6. Subjective age is about 7 mean absolute error, which is pretty good, because I cannot predict, for example, the opposite sex with the same accuracy. Usually predict them younger significantly. The deep neural network does it much better. Also, we demonstrated that both psychological age and subjective age predictions are very correlated with mortality. So we can now predict mortality just in the same way as we do with blood age. So if you are predicted to be 5 years or older, the hazard ratio goes up, both for psychological age and subjective age. And subjective age is actually a very good measure of when you're going to die. So how old do you feel? It's very important. Then we deconvoluted those networks into features, back into features, and kind of grouped them into the different risk factor categories, and looked into categories like personality, psychological beliefs, personal well-being, demographics, health, and showed which ones contribute to the hazard ratio more and which ones contribute to the hazard ratio less. And the most important outcome there was that longevity expectations and optimistic outlook on life is the most important aspect of both psychological age and subjective age. And the easiest way to modify those is to stretch your longevity expectations. And the best way to stretch those longevity expectations is to strategically deceive yourself that you are going to live longer. And the best way to justify it to yourself, because we are actually quite logical beings as well, is to learn about biomedical progress and actually attend sessions like this, and then positively reinforce this belief over and over and over. And basically that's why, for example, Aubrey's teachings and Peter Diamandis's books are so important. Those are technically digital therapeutics for you to be in better mental health. So I never consulted a psychiatrist, and I actually feel great. I like feeling great. And now I basically came up with a routine for myself to strategically convince myself that I'm going to live longer. And that actually gives you great peace of mind and energy. So, if you are to take something away from this lecture, just make sure that you also try to convince yourself that you're going to live longer, and be more optimistic about life, and try to go after more challenging projects. So we also started integrating wearables. A lot of people are doing that. And we are looking at heart rate and oxygenation of blood and many other readouts that you can take from your regular wearable, connecting that together. And this is the tool that we envision to drive the longevity as a service. So currently we provide aging clocks and some very basic recommendations for longevity, and we can provide you with tangible measures and tangible recommendations that you can relate to shave some predicted age off your clock. And now we're working with insurance companies. So we've got some pilots cooking. Lots of deployments with clinics already, with diagnostic centers, currently also trying to penetrate pharma, both for enrollment and monitoring of clinical trials. We have a few of the geroprotectors being monitored using these clocks, beauty clinics, wellness centers, beauty product suppliers, and even longevity education. So now we try to deliver this longevity education through the app. And I think it will be great for employers as well, especially for those that are a little bit more innovative. So I can envision, Amazon or Tesla using something like that to make their staff more optimistic and healthier. So I wonder why people are not doing that. So the major stakeholders, as I mentioned, are clinics, insurance companies, and employers. One of the major partners and the really amazing clinics is Human Longevity. Now they're run by Dr. Wei Wu He, a really amazing Chinese American, PhD from Baylor, a postdoc at Harvard, MGH, and then became a very successful entrepreneur. So now he runs Human Longevity and provides currently pretty wealthy clients with a very comprehensive health assessment with follow-up. They have a partnership with Harvard MGH to access the doctor network. And now they also offer the aging clocks. They were actually the original investor in Deep Longevity when we spun off. So both ATP Ventures and Human Longevity Venture Fund, and actually a few other really very high-profile investors invested. And now we're trying to build the longevity network where it starts with data collection, goes on AI for age prediction. You've got reports going both to the customer and to the doctor, and then it's being passed to the clinic and also to the insurance companies. So I think that it's extremely important and possibly will be available to academics. So this is currently the vision. We're trying to build this vision into reality by partnering with clinics and insurance companies separately. But in the future, we see this as a connected live beating systems. And that's why it's extremely important to standardize those clocks and ensure that people are using just one type, or at least they know how to interpret it, and there is criteria for those clocks. And there is also a hospital path. So we, of course, want to explore all kinds of experimental interventions and turn the longevity products into essentially venture capital products, where you create an actuarial model and look at how much life do you gain and how much risk do you accumulate in the context of your personal longevity. So some things may have side effects, but those side effects might not be as important as the life you gain. So again, we introduced a longevity education program where you can actually learn a little bit more about those concepts, and we're offering it to physicians for free, and it's also CME accredited. Don't forget to register for this conference. This year it's on site in Copenhagen. However, it's also online, and all the who is going to be there. All the startups are there. And I'll ensure that a pretty substantial number of pharmaceutical executives are going to be there as well. So thank you very much. And I would love to answer any questions. Let's connect on WeChat.
Wow, that was a lot. Thank you so much, Alex. This was fantastic. Yeah, I mean, it's there's very little, I think, that that you don't have your hands involved in. So thank you so much. First of all, before we start even into the Q&A, how much time do you have? Because we're now at the hour.
I still have 1 hour before my next call. Sorry, for 40 minutes before my next call. Okay,
well, let's see how quickly we get through it. I have a bunch of questions on my end, but we have a few here in the chat. I do want to reiterate, this was really fantastic. Thank you. And you see that in the chat as well. And I think first one here, we have Josh. Josh, if you want to unmute yourself, go for it. And for the rest, just conduct your questions in the chat or raise your hand here and I'll take you on.
Yeah, I was curious. I don't know if you've heard of Forward Health. They're like a clinic in the Bay where they collect. Okay, I was wondering if you guys have partnered with them or if you can send samples from them.
Not yet. If you can help us partner with them, that would be great, because I think that this is actually as close to longevity as a service as it can get. And that was the clinic that I was referring to as, McDonald's for diagnostics. Okay. It's technically not the most ideal solution, and of course they're driven probably using by other motivational factors, but we do collaborate with clinics like that are preparing to franchise, and there we're also looking at interventions. Because of course, diagnostics is one thing, but then there needs to be a very clear path to an intervention, and that's the only way to make your application sticky. Because if there is no, imagine Uber without drivers, right? So you can see where they are, and you can see where you are, but you cannot get from point A to point B. So you really need to ensure that there are drivers, and without physicians, it's impossible to do that. And yeah, please connect me to Forward if you know these guys. And also very important, one of the reasons why I'm doing this talk is that we are hiring. So we're hiring at senior level, including people in business development. So if you are intertwined in the insurance industry, or if you are good in selling to clinics, we are hiring currently.
All right, thank you. Next one up, we have Eduardo. And oh, Alex, one thing. Can I make sure that in case there's an open job position, you send it to me and I'll include it in the follow-up email after this call?
For sure. So we have, it's more about people finding us. We'll find a position for them.
Okay.
If they're very good. So again, we're currently looking for the chief business officer and business development officers, but that's primarily, so it could be very scientific, right? If you're selling to the pharmaceutical industry, and there you need to provide a lot of evidence that the clocks work in a very specific way, and they can measure the outcome measures that the pharma company is interested in. So that's one type of people that we're looking for. Of course, if they're more focused on selling to clinics, that's another kind of angle. And for that, very often you don't even need to have a medical degree. And insurance companies, that's the most important part. So if you have experience selling into insurance and specifically working at the kind of innovation sourcing level of the organization, we would really like to talk to you.
Lovely. And we'll always finish the talk with, what can this group do to you? But before that, we have a bunch of questions. Next one up, we have Eduardo. Eduardo, if you can say maybe one sentence about yourself, just that Alex has some context on who you are.
Cool. So I'm a graduate student at Caltech in the bioengineering program. And recently, in the past couple months, I started learning about the field of aging. Before that, my expertise is all like single cell RNA-seq and bioinformatics. So all this stuff is relatively new for me. And one of the things that, caught my attention when I started reading about the field was the epigenetic clocks, obviously. And as I started reading about them, I was like, holy crap, just doing linear regression works really well. Like this seems a little too good to be true. And then I saw a bunch of papers on not only epigenetic, but also transcriptomic clocks that for longevity and C. elegans worked really well, and were also just using linear regression. And I was not aware of all the modalities that you showed today. I'm definitely going to look up your papers. But my question is, you talked a lot about deep learning and the issue of having interpretable models. I think that the biggest surprise for me in learning about this field of clocks of aging was how well just plain old linear regression works. And my question is, in your experience, like, what is the breakdown between like situations where like linear regression does the trick and situations where it's like linear regression is not up to the job, but then you were able to make it work with a deep learning model?
So, I will probably, because I'm not sure if other people are as good in data science as we are here, especially you coming from Caltech. So I just refer you to a paper. You can probably see my screen, right? So machine learning on human muscle transcriptomic data. We published it in 2018, but we did the work in 2017. And here in this paper, you can see a comparison of the different algorithms, and specifically for ranking. So you can basically look at SVM, random forest, elastic net, DFS, right? And then you would also look at how they pick the most important features, and some of them have different accuracies. Some of them they have different robustness. But what's important is that how they which features they prioritize, right? And actually, by combining multiple machine learning techniques and also linear regression, some just very basic stats, you might be able to sometimes again get some biological relevance, right? Because you understand how they rank, how they work, right? What is usually important for a specific algorithm. You understand the amount of data you've got, so number of samples, and the number of features in each sample, and then once you get the experience of predicting different tissues like this, you see that it's actually sometimes valuable to combine some of those clocks, right? And those methods, and also compare them. And then, I mean, here we actually did just very simple border count to do the final rank, and we identified some druggable, possibly druggable targets for sarcopenia. But that was, again, kind of a very exploratory work that we're not exactly proud of, but it kind of explains, it answers your question.
Yeah, definitely. Thank you so much. I'm gonna look into that paper. That's awesome.
Thank you. Next one up, we have Lee.
Hey, Alex. Hopefully you can hear me.
Yeah.
Yes, I can be heard. Okay. Hey, Alex, good talk. Thank you very much. So, I think it's a bit naive to reset some blood markers to a younger age, like cholesterol, because, for example, middle-aged women onwards are more protected by higher cholesterol levels. So I think you'll agree with that. But I don't think you wish
yourself. Are you a medical doctor as well, or not?
No, it's Lee Driver. I've been measuring hundreds of biomarkers for many years.
Oh, yeah, okay.
Yeah, the geeky guy in Slovenia, right? The Scotsman. So, Alex, the question I wanted to ask is you quickly said you were not a believer in epigenetic. I'll say believer in epigenetic clocks, but you passed over it quickly. Could you clarify that, please?
So again, I didn't say that I'm not a believer in aging clocks. I said that that's the most accurate biological clock you've got to date. It's just not very interpretable, and it's not super actionable from my standpoint, and I might be wrong. And by the way,
I don't think you're wrong. I just would
right?
like a little clarification. What do you mean by it's not? What you're saying is it's not responsive to treatment and lifestyle change. It doesn't respond quick enough.
Yeah, so that's one thing. And another thing is that there is always a trade-off between accuracy and sensitivity to interventions, right? So some clocks are extremely variable. So one person can be younger and older on the same day. But that's exactly what you want, right? You want to understand what makes you younger or older on the same day as well. And what is it that makes you older and younger over a long time, right? So I'll actually first answer your first question, like cholesterol modification. I actually agree with you. So it might be a defensive mechanism in the later life, right? We just we don't know. We're just showing what needs to be changed in order for the deep neural network to predict you younger, right? It's just there are not that many things that it's kind of like, think of it as wrinkles, right? So as wrinkles on the face. So we actually do have a photographic aging clock, and I'm the advisor and the early investor in a company called Hout.ai. You should get them on the program. They're amazing. They cater to all of the big consumer companies, pretty much everyone that deals with cosmetics, and they're run by a really wonderful scientist, female scientist, Anastasia Georgievskaya, she published a paper with me called Photo Age, where we took a very large number of Germans from 17 to 70. The data set was consented and provided by one of the largest consumer companies. And we demonstrated that you can build an age predictor which is 2.2 years accurate, so very accurate, right? And then you can use different techniques, for example, covering different parts of the face to see where are the major features that make you older or younger. And that algorithm, that study showed that those features were around the corners of the eyes. So if you fix the wrinkles there, you are predicted to be younger, right? Of course, that doesn't necessarily mean that you're going to be healthier or younger, etc. But you are going to be predicted to be younger by the network. So we follow the same kind of philosophy with blood and other markers. Again, I'm not saying that it's wrong. That it's right. It's actually possibly wrong and likely wrong because when you're talking about blood biomarkers, many of those systems are interconnected, and this cholesterol again might be cardioprotective. Currently, there are multiple schools of thoughts, but we can at least show, so this is just an experiment, right? So we at least can show that you would be predicted to younger if you change some features, and it comes from an algorithm. So it works in a biological system. So that's a great thing to see. I'm saying that it's not. I cannot say that it actually will make you live longer yet. So for that, we need to have longitudinal data, and nobody has done that before. But the thing is that if we don't try, if we don't test, and if we don't study this area in humans, we won't go that far. It would actually be nice to do this experiment on animals, but it's just not something that I work with.
Thank you. Next one up, we have Keith.
Hey, Alex, great talk, very comprehensive and really exciting stuff. Quick question here. So you had mentioned that you're partnering, obviously, with some companies in pharma and maybe cosmetics industries. Are you currently partnering with any like other types of industries or companies there, or do you have any plans for other ways? Some of these technologies have potentially broader applications that could serve as a way to bring more people into being aware of this kind of work. So I'm just curious if there's anything like officially on the roadmap, or still kind of thinking about it.
So of course, constantly thinking about it. I come from a semiconductor industry originally, right? So when I was still in my early 20s, I made some money in that industry, and that enabled me to go into biotech, right? And of course, I'm very, very interested in partnering with pretty much anything tech, right? The ideal partner for us would be, like, my dream job would be with Amazon, right? Because these guys can provide longevity as a service in a very true nature and the true meaning of this word, right? Because currently they help you waste time. So all the consumer goods you are buying that you don't need, those extra pair of shoes that you will never wear, you spend a lot of time on their platform searching and playing around with, and they also provide you now with content like Amazon Prime Video that basically wastes a lot of your time, and sometimes in your optimal state of health and well-being. So it's only natural for them, to follow the ESGR, some environmental, societal, governmental, whatever guidelines, to give this time back to people. And they accumulate a lot of data about you, much more than we can ever collect ourselves. And people trust Amazon. It's the most amazing platform. So, if I could partner with AWS or Amazon itself, that would be a dream, right? So, of course, we're looking at those big cloud providers, but currently they lack this vision. And my job partially through those talks, and hopefully I can maybe ignite somebody else to bite those guys so they get this longevity virus. So somebody at the very top thinks that, okay, well, aging is the universal equalizer. 1 billion, 2 billion, 3 billion, 5 billion doesn't make a difference. You don't fly business class to arrive earlier. So it's just you make your life a little bit more comfortable, but it's not necessarily better. So I think that the most impactful thing for these guys to do would be to get into longevity and really explore the longevity as a service. I think they tried to do something like that with Berkshire Hathaway and tried to do this insurance slash healthcare partnership. But then it's likely, probably it ended up with some really high profile management consultants that turned it into just a very simple, plain business model that maximizes profit. So here you just need to maximize research and maximize human life. So for me, partnering with an organization that has a lot of data that helps you waste time, in order for us through this partnership to make time, that would be a dream. So of course I'm looking at that, and any possibility to work at the higher level of those organizations would be a dream.
Thank you. And I guess this is a good tag along to a follow-up question that I had. You mentioned a variety of different specific services that one can already access, right? Even like young AI and so forth. What are like next steps for those individual efforts? And is there anything that people in this group could do to help those along?
For sure. Well, they can come work for Deep Longevity if they're qualified, right? Because of course, we're currently not super well funded, so we do have the funding. However, it's not super well funded yet. It's a public company. However, the stock is not trading at anywhere near the levels where it would be possible to fundraise much more effectively. Even though, again, to me, I think that's a hugely promising company and area. So we are interested in people who can really turn it into a bigger business, specifically in those verticals, the insurance industry and the clinics. And of course, we have the consumer-facing app. We are working on it to be able to connect the user to those two industries, both insurance and health and clinics. But that will take time, right? Because those industries also need to grow up in order to be able to partner at this level. So we are a little bit ahead of our time, and we always were ahead of our time. Actually, at Insilico, if you remember, 2016, I was presenting this generative chemistry. Nobody believed me, and now we're getting those mega orders from big pharma and also progressing the drugs through the various stages of clinical preclinical development. So I think that we will get there sooner or later too. So we will get this longevity as a service going and connect insurance and clinics. I hope that it will happen sooner than later. The way to help us is to come work for us or help us connect with those players more efficiently. Because I don't think that there are a few groups that are also very dedicated to longevity in a very with a very credible business model, and actually deeply admire those groups. But there are very few, right? And we're one of them. So we need to stick together and try to promote those businesses so that they become more profitable, more active, and we need to embed those businesses deeper into the major stakeholders that are currently driving the world, right? Because changing just one stakeholder, insurance will not change without medicine. Medicine will not change without insurance. Pharmaceutical companies will not change without medicine and without insurance. Academia is not going to accelerate without, so it's not a rat race like in semiconductors yet, right? So without a huge consumer business. So in order for us to drive the longevity as a service vision, we need to ensure that all of those areas are progressing very quickly, and we cannot progress faster than medicine. So that's why we need to ensure that medical doctors are engaged, involved, and educated. So, if you want to contribute, take the longevity medicine course and give it to a friend. It's free. You get a CME credit and certificate that you can put on a wall.
Yeah, I love how you ran through every different sector, and you were like, this sector is here, and it could do this. And so, yeah, well, thanks for that bird's eye overview. I guess in particular on either and or machine learning and aging clocks. Do you have any predictions where there are interesting fields for folks that are excited about either using machine learning for advancing progress on aging, or really of trying to do something either by really standardizing a bunch of aging clocks or something in that regard? Like, where would you see in particular those fields headed? Are there any particular future challenges that are interesting to take on? Because many people here in this group have an interest in this and are either already working in this or are currently putting their minds to it.
So for sure, well, first of all, I think that the best way to operate in this field is to join one of the companies or academic groups that is already working in this area. I think that there are many more data types that we could work with in order for us to predict age and also try to understand it better. So I think that if you are just in machine learning currently, and if you do not understand biology very well, go into imaging specifically and go deeper into imaging, start working with the MRIs, CTs, and other data types, and ultrasound. I think that there is huge opportunity for advancement in ultrasound, because that's where you can build better aging clocks, try to get this very accessible data type into the clinic. And again, I'm a huge fan of ultrasound. If I had more time and resources, that's where I would go, because that's one of the ways to get into non-invasive diagnostics quickly, and actually gives you pretty good resolution of your tissues and organs. And then try to combine ultrasound with something that is more exotic, so like gene expression. Or mineralization levels, or crosslinks. And I think that combinations of different very accessible and very exotic biomarkers is the way to go, because that's the way to make the exotic biomarkers cheaper, because some of the data types are very expensive, right? So and for some of them you really require to have very advanced equipment. And if you can substitute some of them, or basically get the same answer to your question, to your medical question, from another data type, that is extremely valuable. So just my advice is that ultrasound, right? Then another really cool...
Can I just ask a question about ultrasound? Yeah. Have you seen that it works well with other species than just humans?
So actually, this is one of the very few data types where there is more human data than animal data. So to be absolutely honest with you, I don't know. Another really cool advice, and I've been thinking about this a lot, is if you are starting your career currently in this area, or if you are thinking about switching it or going into the business, I would recommend going into monkey business. So specifically looking at monkeys. So, and because I'm talking to a lot of contract research organizations currently, especially in China, that experiment on monkeys, and it turns out that, or the supply monkeys, turns out that most of the monkeys that are being supplied to pharma are exactly like 3 years old, because if you are below 3 years, they are considered to be immature. If they're above 3 years, they are too expensive, right? Because you need to feed the monkey for 1 more year. So technically, all of the experiments like most of the experiments are done in this kind of age range, right? So nobody is trying to mature them and look at them longitudinally.
Are you talking about rhesus or marmosets?
Doesn't matter. Something that is closer to humans than mice, right? And something that is intelligent and can jump on trees and exercise. So I think that having a really cool collection of data coming from monkey colonies, that would help us much more, because then we would be able to actually test those, well, answer those questions that were also raised today. Well, what about cholesterol? What if we, turn it back? If we reduce it, is it good or bad, right? Is it gonna affect your longevity or not? And those are the animals where we can actually go and, sample the tissue a little bit more, in a little bit easier way, right? Of course.
This is interesting. I think it really mirrored also what we had Veronika Kohansky on here from the NIA, and it's exactly what he said. It's exactly, okay, what species can we find so that we're moving away from mice and we're getting a little bit more closer to humans.
Yeah, because mice, they just do not live long enough to accumulate the same forms of damage that we have. And it's just sad.
Yeah. Okay, one last question. If I'm now a potential customer, which website do I go on? So, there's the longevity degree, but there's also Young AI, right? So, because at the beginning when you mentioned, okay, if you're not already tracking your health data, you're already losing out, right? Like, let's say I'm convinced, what are the easiest next steps to do for not just someone that may want to work for you guys, but also someone, for who is just really excited and wants to use these products?
So currently, in terms of customers, we only, from a customer perspective, we view B2B as the major segment, right? So it's if you are running an insurance company or if you are running a clinic, please do come to us. We'll partner with you. If you're a consumer, currently you can download the free app and start using it, and also report to us anything that you like or you don't like, because currently we're trying to play mini Bezos and basically put the customer in a chair and try to focus on user experience, because we have a weekly user experience call. We try to understand what people like, what people don't like, and what would make the product more sticky. Currently, it's a very experimental system, so we can swing it in multiple directions, but we haven't pushed the trigger currently in terms of where we want to go. So it just is an app which allows you to track biological age and allows you to tell us as much as you like. So you control how much data you give. You own the data. You can delete it. You can delete it. You can get out of it anytime. We won't keep it. And in this context, we want to ensure that we just get user feedback to make a better product. And that's what we're looking for.
Okay, so to summarize, if you want to work if you want to work for deep longevity, go contact or go on the website or read the email that I'll be sending out afterwards. If you work for Amazon, then also please immediately contact Alex. If you're on the consumer side, you may want to be joining the consumer test. And apart from that, I think you mentioned a really few fantastic ways for either really getting longevity education out there with a longevity degree, or by just downloading Young AI and starting to participate. Thank you so much also for noting a few of the areas that machine learning researchers could go into and look into. Super, super valuable. Is there anything I'm missing that could be useful for deep longevity or Insilico?
I think that we are actually doing quite well now. And you'll hear some really cool news. So we're not in dire need of anything. We're short on really highly qualified and competent staff in both cases. Yeah, I just think that it's a very good time to be in longevity. So if you have a friend, have a dinner with a friend and convince that friend to get into longevity, because everything else they're doing is pretty much waste of time.
Yeah, thanks. No, it definitely sounds like you're on a roll there. I'm super excited. I mean, I guess if I only follow up in like half a year or something, then the slide deck is even, 2 hours long or something. So I'm super, super, super grateful that you shared so much with us. And yeah, thank you for all your work. Thank you for even taking time so freaking late in the night to share this work with us. really, really, really appreciated by everyone in this group. Thank you everyone for staying on so long. And we are now finishing with the main talk. Alex, I'm hoping that I can reach out to you, maybe get my hands on your slide to share it out with folks. And we are now doing a few community updates. In particular, we are going to be starting with Jonathan Carlson, who has a similar, I think, announcement to make. And if anyone else afterwards has a community update and wants to go for it, please drop me a note in the chat. And otherwise, we'll be seeing you for our keynote meeting next week, Thursday.
And,
Jonathan,
agingpharma.org, please register for this conference. Again, it's University of Copenhagen is getting the funds, but it's a very important conference, and I'm sponsoring, I'm supporting it, and we're building a community there. So you can see that it's for the first time. eLife and Frontiers are actually sponsoring it. So usually you sponsor the journal, here it's the other way around. And Lancet, Nature, Aging, they're all supporting it. So it's a high profile conference, please do come there. And this year it's gonna be at the Grand Hall of the University of Copenhagen. So, it's the Viking guys, the guys who are now popular on Netflix. Everybody's talking about Vikings, so come to the home of Vikings, right? And Morten Scheibe Knudsen is the most amazing researcher and longevity medicine practitioner. So he is MD PhD. He is the main chair of the conference, and it's a great community. So we'll try to be there on site. So get vaccinated and get to Copenhagen.
Thank you so much. Okay, Copenhagen's calling. Okay, thank you so much, Alex. And next up, we have Jonathan with a community announcement. If anyone has another one to share, then please just let me know. Otherwise, there'll be a next time again next Thursday. Jonathan.
Thanks a lot, Alex. I mean, a good shout out for the Vikings. I'm not sure I can claim that myself, but Copenhagen is a great place. It was great meeting you way back, right? 4 years now in Berlin or so. So excellent to see this development. Really, really nice. 3 quick things. I think one, really appreciate the holistic view that you're having there and the time wasted and so on. I think I can very much agree with that. I do have a couple of contacts into high level executives in Amazon, so I will talk to them in the next couple of days and then hopefully connect you. If there's anyone else that I can connect to, super happy as well. Also hired 2 great commercial guys just this week to my own venture. Got a couple of really good examples where we've been super happy with sourcing people. So if anyone else in the call as well could be happy about like some way to source both commercial guys and particularly really technical guys, that's also been very valuable for me. Happy to share that one. And lastly, not what we're trying to give back is from our organization, we're hiring 2 people ourselves, a COO and also channel strategist. Why we're doing that is because surely I cannot compete with you in any sense when it comes to the lab work, excellent work. But we believe that I worked myself a lot within effective altruism, for example, and sustainability. So I'm used to completely failing at communicating something extremely interesting and valuable and important to people who simply don't want to listen. And I think we all had this a little bit with longevity as well. So what we're trying to do is A/B testing throughout certain keywords and so on towards the market, how we can much better communicate around longevity. And hopefully we're building then a more commercial platform that can be shared within this community as well to kind of, put this onto a broader base out there in society. So if that's of any use to yourself, Alex, or anyone else out there, then we're happy to share. So we'll come back
Lovely.
to this.
Well, thank you, everyone. Thank you so much. Thanks for staying on so long, Alex. I hope you get to see. Oh, one last question. Do you said you connected to Fitbit. Do you connect it to the Oura Ring already? Do you track the Oura Ring?
No, we don't. We don't.
Okay. Never mind.
But it's a good thing to do, right? And it's becoming much more popular. So we try to get the wearable data and of course the sleep data as well. But currently we just don't have the capacity to do a lot of research on this data. So we hope that we will be able to do that in the future. But currently we are looking at other data types that are, consumer friendly. And I must say that I was extremely surprised how people are interested in psychology of aging. So when we launched our test, more than 300,000 people took it in basically 3 weeks. So without any advertising, without anything. So it was a major driver. So people are very interested in how to do this. And I think that this is a very engaging area. So I think psychology of aging is underappreciated. And I myself, I thought that all the psychiatrists are, I'm not going to say that word, but not exactly very credible and necessary and a waste of time. But now you can actually, looking at longevity psychology, I think that this area needs to evolve and get into the hands of those, thousands of psychiatrists in the States, because I think that you can actually fix people by making them more optimistic, by giving them actually longevity education.
Well, and that's what you're doing. And then again, I think it's a positive feedback loop. So I guess the more likely it is that the more younger we look and so forth and so on and so forth, it is a more positive feedback loop to get into. So thanks for doing all of that. And yeah, I'm super excited for what's next. And I am hoping to see many of you next Thursday, where we have a very, very full house. And we're going to be talking about aging clocks again. And this time with Vadim, Morgan, and a few others. So super, super excited for that. Thank you so much, Alex. It's been really a pleasure. Bye, everyone.